All right. I'd like to call our Community Services Committee meeting to order for, what is today? It's the 19th of January and we're starting at 7:03 p.m. Let's see, we can just start with our call to order and roll call. I see on my screen, no particular order, Diana Revolus and Nicole Ayers.
Present.
Thank you. And then Barbara Smith, Greg, and
present.
Thank you, Councilman Burnett, and myself, Dominique Johnson. So you have a quorum. Oh, Tom Keegan. I see Tom Keegan. All right, we definitely have a quorum. Thank you, Mr. Keegan. All right, and I want to ask, I assume, Councilmember Young, are you joining us in so far as your council duties or for community services? I want to reflect the record appropriately. Should I call this a roll or is this, should I include you in our roll call?
You're able to sit in.
No, I think just as part of attendance, right?
Just as
great.
part of attendance, yeah. Not
That's
as
fabulous. Well, thank you, Councilwoman Young. I will let the record reflect that you are also in attendance. Thank you so much. Appreciate it. All right, so we have next public comments. Is there anyone waiting to be heard here on the meeting? I see we have an attendee, Diane Lauricella. Anybody else, please raise your hand so that we know you're here. First, I'll pass the floor over to Ms. Lauricella.
Good evening, Chairman Johnson and committee. Happy New Year. We have some challenges ahead. I just recently sent each of you an email that I would like placed in the record that reflects an email I sent to Chairwoman Johnson and the health director at the end of December, right after the meeting. It represents one of the ways I've been attempting to assist my city. I wanted to seek direction from you, Chairwoman Johnson, about corrections to the minutes. I ask that possibly you table these. I didn't have time to write in the changes. There are many related to my what I did state versus, and I appreciate Telesco Services' attempts to compartmentalize or synthesize what I said, but what is on the record does not reflect what I said. Now I could select 1, 2, 3, 4, or 5 sentences for correction, or would you prefer that I submit my suggested changes in writing for your next meeting?
I think if it's 5, maybe we could do that. But I mean, frankly, if you've already gotten it written out and it's a copy paste, that would be fabulous to submit in writing. That would be ideal. Thank you. That way nothing gets lost in translation. That's great.
Well, I'm just before you accept the minutes, is there a chance that you could postpone or table the acceptance of the minutes because they are quite different than what I stated? How would you like me to?
All right, so the request has been made to table our acceptance of the minutes. I can ask the committee if there are no objections to that once we get to the approval of the minutes next. If that's all right with you to proceed that way. Do you have another public comment tonight for us, or was this in reference to the minutes?
I just wanted to say that I, again, I'm still awaiting a response about having a meeting, a proactive, productive meeting with either the health director, any of her staff. I know she's very busy, and the chairwoman or any of the committee members on the items that I mentioned during my discussion last month. I still feel that there is a need for education about how to wear the masks, what type of mask to wear, and there are creative ways to help our citizens not get infected by any variant in the future or at this present time. So I look forward to listening to the report that was postponed last month during a pandemic. And I ask again for, please send me 2 or 3 dates and times where I can meet with the health director, as I've done in the past with past health directors. Thank you for your time and your service, everyone.
Thanks for comments, Stan. Ms. Loricella, I'll say that I remember you and I did speak, and one of the things that you requested was that we talk about mask guidance. So based on that conversation, that's part of our presentation tonight from the health department. So based on our previous meeting, I appreciate that feedback, and we've reflected it tonight. And we can move on to other public comments. Is there anyone else here that would like to speak during public comment? All right, did any committee members receive any correspondence related to community services? Obviously, we will enter Ms. Loricella's email into the record. Any other correspondence from any constituents to council members? I take that as a no. I'll take it as a no. All right, so that means we can move on. And before we do, actually, I don't know, maybe the point of order, I'd like to propose a change to the order of number 4. But I'll do that before we get into it. I suppose we'll go to number 3 now, approval of minutes. I'll throw this to the committee. How do you feel about tabling approval of our minutes till next time? Yes, Ms. Revolus. Yeah.
Isn't there a way to approve it with the key with the changes that's going to be had type of thing?
Yep.
That we can probably just do?
I was thinking that's a great idea. Thank you for mentioning that and proposing that. So with that said, I'll ask for a motion to approve our minutes, or thank you. Thank you very much, Councilwoman Revolus. And Ms. Smith, yes, do we have any corrections, additions, changes?
I'll move them to approve the minutes that incorporate Ms. Loricella's changes.
Very good. Thank you. Thank you. We can do that retroactively. Any corrections, additions, deletions that council members have for our minutes? I have one. Any others? Anything misrepresented, how you said, you please feel free to make that change. The one I have is at the bottom of page 1, and it's just for Councilwoman Alterman's first name Heidi to be spelled with H-E-I-D-I as opposed to the E. That's all I got. Yeah. Okay. All right, well, the motion is on the floor. We can call for a vote. All in favor of approving the minutes as amended, including Ms. Loricella's. We are unanimous. Thank you. We're good. All right. Moving on to number 4. So I'd like to propose that we switch the order and we flip A and B. We have our updates from the health department first. We're going to make Mr. Daniel stick around the whole time. So I figured this would be a nice way we can have our epidemiologist and health director present first. Are there any objections? Or I'm seeing none. That means we can do it. That's fabulous. I don't think we need to vote on that, do we? I don't think so. Just the way we're going to do it. All right. So that means we're moving on to our discussion portion, updates from the health department, and I'll hand it over to our health director, Deanna Demore. Thank you so much.
Good evening, everyone. Councilwoman Johnson, is it okay if I share my screen, my slides?
Oh, absolutely.
Slides?
Absolutely.
And then,
Thank you so much. Yeah, that'd be perfect.
okay, good evening, everyone. So just give me 1 second. You all able to see my screen? Okay. So I just wanted to share some updates about the health department overall, and then we'll just go into reaccreditation. And Brian Weeks, our epidemiologist, is here, and he'll be able to give an overview of our COVID updates. Sorry, my computer is freezing right now. Give me 1 second. Sorry. Okay, let me try again. So I wanted to just go over public health. So I will go into some of this and hopefully my PowerPoint will start cooperating soon. But I wanted to talk about, what public health is. So we're all about assuring the conditions in which people can be healthy. So public health looks at the broad scope of, there's a lot of things that impact someone's health, right? The communities in which they live in, their behaviors, the choices, the social factors, economic factors, environmental factors. And so public health really looks at health in a broad lens. And so that's what we're focused on. And we're focused on, assuring the conditions in which people can be healthy and they can, fulfill their best overall health. And so we are really guided by national frameworks. And one of our biggest frameworks is the 10 essential public health services. And so, and equity is like one big part of that. And so I'm sorry, can I just have 1 second, just try to pull up this PowerPoint again. All right, it's not cooperating, I'm sorry. So we're focused on the 10 essential public health services. And we're also guided by, that's also in state statute. So we're guided by national frameworks and state frameworks as well. And the health department over the years has really expanded in staff. And so we currently have 32 full-time staff members and 9 part-time staff members. And a lot of our staff, we have both city-funded and grant-funded staff. And our big overall areas of focus are on environmental health and housing, community health, disease prevention, disease control, and with underlying frameworks of administration and operational support, epidemiology, and emergency preparedness. And so that's our focus. That's how we're structured. We can go into more details about different programs and services in later meetings. But it's really those frameworks that guide, our mission, our vision. Our vision is excellence with efficiency. We're about preventing and controlling the spread of disease within communities. So the other big focus of ours is just partnership. So we're part of a whole public health system, right? The public health agency is just one part of many different partners that are working together to improve the health of the community. So we see ourselves as, we're part of community services, just like the Lamont and all the different departments, we're really conveners in the community, we're facilitators, we're trying to solve problems collectively together to improve the overall health. And so if I can get my PowerPoint to cooperate after Brian's presentation, if you're okay with that, I can just show you a couple of those slides just so you can see the layout of our organization. But I did want to give an update on reaccreditation. So the Norwalk Health Department is a nationally accredited health department. We became nationally accredited in 2014. We were actually the 44th health department in the entire country to become nationally accredited. So it's something we adopted early on. Our previous director was really passionate about it. And so the staff really worked hard on earning that accreditation. So that means that we meet or exceed the national standards for public health. And recently we've been going through a reaccreditation process. So every 5 years, health departments go through a reaccreditation process. It's a voluntary program, so it's not a requirement, but it's something that we've gone through. We started going through the process, and then we had uploaded all the documents. We got through everything, and then COVID hit and the pandemic hit. So we had to put some pause on some of the activities, and we got extensions. But recently, we just had our site visit with the reaccreditation team, and it went really well. We got very good feedback. They reported that we met all of the measures that we had all the measures that had been put forth for us. And so we're still awaiting the final decision from the accreditation committee, but we're hopeful and we were happy with how that process has been going, and just really proud of the staff and everybody that's been working hard on it. So it's something important to us, and it's something that we're going to continue to do. Like the police department in Norwalk, it's important to us as well to be accredited. And so if it's okay with you, I don't know if there's any questions, but reaccreditation at this point. But if Brian can do his updates, and then I can just circle back with a couple other slides, if that's okay.
Madam Chair, I did have a comment.
Oh, absolutely, Ms. Burnett. Mhm.
Yes, thank you. I served on the Board of Health when we went for the accreditation in 2014, and I just want to say that the work has the value of getting accreditation has presented itself in so many different ways. I think it has created Norwalk to be the leaders as it relates to public health, especially during the COVID time. The fact that we have the accreditation, I think the several entities, organizations across the state of Connecticut look to Norwalk because of that accreditation. So I just wanted to echo the support to the health department for the good work that they've been doing. And hopefully the accreditation will come through. And it's very important that we have that. And again, it's become one of the highlights of the support that the citizens in Norwalk are receiving at this time. So thank you, Deanna, and your team.
Thank you.
That's excellent. Just curious, Deanna, is this a annual reaccreditation, or it must be more of a timeline there? Like, is it every 3 years?
It's supposed to be every 5 years, but
5
every
years.
year we, you know, the point of a accreditation process is to, you know, continuously improve what you're doing. So every year through that process, we report on what we're doing and how we're improving. So it's something we have to maintain every year, but the actual like status of reaccredited, it's every 5 years.
That's been a big task the past few weeks, I can imagine, or months. Yeah, so excellent. Thank you for that update. Any other questions about the reaccreditation before we move on? All right, excellent. I'll give the
I
floor
was
back.
actually able to get my PowerPoint. Can I try one more time?
Oh, of course, that's perfect. Perfect timing.
So are you able to see the PowerPoint, the org chart that I have up here?
Yes, yes.
So I just wanted to point out, Councilman Burnett reminded me as he was talking, he is one of our members of the emergency response team. And so we have recently added them to our organizational chart because we've had over 200 volunteers helping us support the response to the pandemic. And so I really want to thank our volunteers for all of the incredible work that they've been doing. So we've recently added them to our organizational chart because they're such an incredible critical component of the department. You know, they're part of our family. They're amazing. So I just wanted to give a special shout out to the volunteers. But so all you can just see quickly how our staffing is laid out. It's color coded for, you know, a lot of different grant funded employees. Not, you know, everyone might not realize that. And so I like to just highlight that. And then this was what I had been talking about, our overall like functions as a health department. This is where we're focused on. So I just wanted to point that out. Thank you.
Excellent. If interested, would people be able to, at least on the committee, be able to get some copies of the slides? Is that appropriate, or?
Sure, yeah.
Absolutely. Okay, I'll let folks follow up with you then, unless there's enough interest. We'll just, you know, I don't want you to have to field like 5 emails. So let me know, I suppose, as chair, and then I can do that. So thank you very much, Director Demore. I can pass it back to you, I suppose, for on our agenda, we have it under, you know, Omicron and COVID kind of all together, but I know that or if we're ready to move on to that, I'm happy, but because I know that's going to be a big, oh yes, Councilwoman Revelous.
Just because I saw that slide and it wouldn't be me. Where's nutrition in any of that?
Sure, that's all in community health, and it's also in our WIC program as well. And so just to give you like a quick update on some of the work in the community health division related to that, we have a healthy resolutions program that's in partnership with the Norwalk Public Library, where people are able to participate. Some of the focus areas are goal setting, sleep hygiene, physical activity, stress, emotional eating, nutrition. So that's one area that's being covered in that program. Each session includes a recipe using herbs and spices in partnership with Penzi Spices. So that's one example of nutrition work that's going on in the Community Health Division.
And actually showing people difference about acidity, alkaline, proper foods, and truly herbs, like truly nutrition. Now, is that a part of it?
I don't know. I can't like answer. I mean, it's focused on nutrition. I don't know off the top of my head the
Can we
specific.
find out?
Sure.
Thanks. That's all.
All right, any other questions? Okay, then, yes, then I will pass that back to you, Mr. Moore, for the next part of the presentation. Thanks.
Sure. So Brian's going to lead off with an update on where we are with COVID. And then I'll provide some additional updates at the end. So Brian Weeks is our epidemiologist.
Alrighty. Well, thanks everybody. Thanks for having me. So Brian Weeks here. I think Deanna, I'm having the same thing come up where it's not letting me share. Don't just bear in mind whoever's kind of running the Zoom meeting, if they can include both Brian Weekses, because I'm joining via 2 devices. So I don't know, maybe it was given to my phone as opposed to my computer. Thanks. Sorry about that. Yeah, it's still showing something blank. Like it's not letting me share a screen. This is interesting. Huh. Never seen it before like this.
I see Andrew's trying to connect to audio. I don't know if he can hear us or not. Let's see, there's a Q&A.
Yeah, still nothing. It's still showing me a blank screen in terms of options of windows to share. I mean, I could try rejoining. I don't know if that will make a difference.
Andrew, you have an update for us, Andrew?
Not,
Let me
I
see
know
if
to
I
look
can
here.
share.
I mean, if you want to rejoin, maybe we can ask, I don't know if you're prepared to do this right now, Deanna, but we like, if there's questions about Omicron and things that you could handle for us while Brian like turns it off and on again, then maybe we can.
Well, I'm still able to join via 2 devices, so I can kind of
okay. Very
verbally communicate. I can't even do interpretive dance because I can't even do that with the screen
Okay.
issue. Rejoining has worked.
Oh,
All
great.
right, so
Perfect.
I think we're lucking out. All right.
Perfect.
So
Hey,
let's
there
jump
we
right
go.
into it. All right, so that's the quick solution. Thank goodness.
Awesome.
All right.
Sounds
All right,
good. Thank you.
Thanks everybody. All right, so jumping right into it, this is kind of the usual kind of update that I provide in regards to COVID-19. So what you're seeing right here on the right-hand side is the CDC county levels of transmission for the last 7 days. It's a nice palette of red. It's probably been the reddest it's been in some time. So red is the highest category in terms of transmission based upon the CDC categorization. So that's 99.5% of all counties in the country. So it hasn't been this high in a long time. And this is really kind of interesting because it used to be like pockets of yellow, say in the Midwest, or maybe even sometimes in Florida, a little bit earlier in the Omicron wave, but not anymore. So it definitely shows how serious things are in terms of transmission levels and activity. On the left-hand side here, I'm pulling from the Johns Hopkins Coronavirus Resource Center, and it's showing global confirmed cases at more than 336 million, global deaths at more than 5.5 million, U.S. confirmed deaths, or U.S. confirmed cases at more than 68 million, and U.S. confirmed deaths in terms of 857,000 plus. So you can see kind of like the impact of the pandemic since we're almost 2 years into this. So really switching gears in terms of what's really been driving, especially the recent surge of activity. As you can see, the purple here on the left-hand side with these 2 visuals from the CDC is Omicron. The yellow or orange here is Delta. So we were dealing with the Delta wave that popped up in August. It was hanging around kind of residually in terms of having impact the community. But then Omicron really entered the picture. And you can see right here, kind of like in early part of December, it really just kept picking up, and really because of its high infectivity, really overtook Delta in terms of transmission. So it's estimated by the CDC for the week of January 9th to the 15th to be 99.5%. So that seems to be the number all around in terms of COVID. But then you see here in terms of the purple. So these are pie charts relative to the regions of the country, and you can see it's all purple pretty much. It's only a small sliver of orange here in the Midwest in terms of Delta kind of still presenting, and, very, very small sliver here in terms of even the Northeast. So, just only a few weeks ago, based upon these simulation models the CDC conducts, it was a lot more orange present. So it shows how rapidly Omicron has spread. And then also this is the State Health Department's assessment too, based upon the surveillance they're doing in terms of sequencing specimens. And so this goes up to January 2nd of this year. And you can see it's at 97.4%. So all indicating the same thing. Omicron's running the show. This is the Omicron show. And so as you can see here, really one of the best indicators, and, we follow this very closely as well as the state, is the state COVID associated hospitalizations. So what you're seeing is the green line is for the total for the state relative to that day of reporting. The gray here is New Haven County, red is Hartford County, blue is Fairfield County. And so you could see how this is for the entirety of the pandemic. We came to a point of almost being about 33 hospitalizations to the same level we were at the very beginning of the pandemic back in April 2020. So I want to emphasize that. The most recent data point has us at the 1,805. So it has dropped off a little bit. And as you can see, there's a little bit downtick right there. So again, this is also further supported by some other data I'll be showing. But we are seeing the plateau have developed, and we're seeing a very slight and gradual downtrend. So this is going to be a kind of slow and painful kind of downtrend. So this is not going to be something that like all of a sudden, hey, everything's, sunshine and flowers. No, unfortunately, it's going to take, many weeks for this to kind of work itself out, not only in terms of the hospitalizations, but in terms of cases. But nonetheless, it's still good to see that we have a plateau. I mean, it's kind of falling very similarly to even the previous season. We kind of saw a downtrend after, the very beginning of January. And it just goes to show, especially in this case with Omicron, one of the biggest variables that have contributed, because we had a lot of things working against us. It was a perfect storm, as I like to coin it. One of the bigger variables is the holidays. And inevitably, the holidays, or any time where people have time off and travel and interact, increases the opportunities for new variants to be introduced, as well as just for the variants to just jump around and spread to individuals it may not usually spread to. So just want to emphasize that point. But right now, in terms of the most recent data point from the State Health Department, Fairfield County is at 24% of all hospitalizations related to COVID, 31% Hartford, and then New Haven County is 31%. So I just wanted to emphasize those points. So another way to look at this is also kind of looking at some other data relative to states, just where we're stacking up. So fortunately, Connecticut is out of like the top 15. We were there for quite some time, trailing behind, New York, New Jersey, Massachusetts, and Rhode Island. It seemed like we were circled. It was like a pincer movement in terms of military strategy. But luckily, it has dropped off. So these are the case averages per 100,000 that the New York Times calculates for the most recent 7 days. And you can see how Connecticut has dropped down to 41 in terms of the rankings for the case rates. So that's really great in terms of just seeing that, that kind of like that downtick I was indicating before. So fortunately, we're not in the top 10, not top 15, not top 20. But again, this is based upon 7 days worth of data. This can jump around, especially if there's anything else extraneous in terms of data or reporting lag. That can also jump things to some extent. So we'll keep an eye on this, but it's really great to see this because we haven't been in this low of a level for some time, given the surge. The Northeast was getting hit really hard, still getting hit hard, but it's not obviously where it was before. So this is the most recent data provided by the State Health Department. It's looking at it from December 26th, last year to January 8th this year. And you can see based upon the state COVID framework, everybody's in the red based upon that categorization. So that's more than 15 plus cases. And as you can see, it's the record high in terms of the case rates. So Norwalk was at 341.7 cases per 100,000 during this reporting period. Again, keep in mind that this is reflective of this timeline that I just outlined before. We'll have a new report tomorrow evening from the State Health Department. So we're looking forward to that, we'll see what it indicates. But it should indicate a case rate that's a little bit lower than where we're at right now. It should be in the 200s. So with that said, as you can see for the case rates for all the big 7 Connecticut cities, including Norwalk, there's a 341.7 per 100,000 of the population, as I indicated. along with a 36.3% positivity. And you can see how we're kind of stacking up with, Stanford obviously being a little bit lower, but not for percent positivity. Waterbury being lower, but also the highest at that time is Bridgeport at 417.1, and Danbury being the lowest at 241.8 for the case rates. So just for that reporting period. So just, we're kind of in the middle of everybody. So just kind of indicative of what's going on in the state. Everybody's mileage differs in terms of their experiences with COVID relative to a lot of different variables. But in terms of total COVID-19 cases and deaths, we have 20,236 cases and 246 deaths related to the pandemic so far. And as you can see in the most recent 2 calendar weeks, this is January 2nd to the 15th of this year, you can see how the proportion changed a little bit. So what we were seeing with the very beginning stages of Omicron is that there was a bell curve skewed to the left a little bit, but it was centered more at 30 to 39 years old, which you still see here. So it's at 16%, but tied with it technically at second or third place was 20 to 29 and 40 to 49. We're not seeing that so much here. What's happened is shifted more to the less than 20 years of age group. As you can see, it's essentially 16% as well, 16.4% for especially less than 10 years of age. So it's kind of what we expect in terms of like the middle-aged individuals, that might have younger families, more mobility, whatever it is, they get exposed, and then consequently they expose other individuals in the household or maybe the workplace or social activities and gatherings, and it just keeps bouncing back and forth into new households. And that's why Omicron has been so successful, and it's incurred infectious trends. So I just want to emphasize that point. So we are seeing that. It's not unexpected, but it's not great to see, obviously. So it's something to keep in mind, and we have to also keep in mind that as we'll see with the vaccination rates for the city, right here, the 5 to 11-year-old age group still has a ways to go because they had the latest eligibility of the other age groups. So they're late to the game, and so we're obviously all trying to get them up there, so that can also help reduce not only the infectiousness if somebody does get infected, but also the severity of outcomes with hospitalizations and deaths. So right now, in terms of initiated vaccination, which means getting at least 1 dose of the vaccine, that is 35.57% for 5 to 11 years old, and then 22.92% for fully vaccinated. So getting those 2 primary doses if they're getting the mRNA vaccine, or for J&J getting that first dose. And then so for all ages, it's around 84% with initiated vaccination and 73.34% for fully vaccinated. So, great to see that number for all ages. But then again, when you stratify by age groups, you can see there's room for improvement, especially for the 5 to 11-year-old age group. So just want to emphasize that in terms of our vaccine rates. But as you can see, kind of like what we've seen consistently as the vaccine was rolled out, fortunately for us, the southwestern portion of the state and also kind of like the south central portion of the state has been doing really well in terms of vaccination. But then you can see especially the northeastern portion not doing so well into the vaccine coverage. And especially when you're seeing the early stages of the case rates, those case rates were really astronomically high in proportion to those that had higher vaccination rates. So the other thing I want to emphasize is, also flu is in the mix here. Because the variability in terms of face mask usage and other kind of the perfect storm of variables that we do have, flu is going around. And this is the CDC surveillance looking at the influenza-like illness activity. And you can see how the South and the Southeast really getting hit quite hard, as well as even California in terms of activity. So they're in the high level of influenza-like illness activity. Northeast also, having that experience as well, especially New Jersey's been getting hit hard consistently, New York too, but New Jersey being very noticeable here. So just want to emphasize that point in New York City. So flu's also in the mix here. That's also complicating diagnoses and also just taking advantage of the circumstances in terms of transmission. So over on the right-hand side, this is kind of related to the following slide. I just wanted to make the best use of space. So this is the NIOSH approved KN95. So basically the CDC has promoted, the new kind of assessment they've done, where about 60% of KN95 respirators that were used throughout the pandemic in 2021 did not meet the requirements they intended to meet. So they actually failed. So a lot of people were using these, assuming that the filtration was going to be adequate when it was not. So this kind of leads to that following conversation, and kind of like what everybody was alluding to today. Fortunately, I was thinking of just bringing this up regardless. In terms of face masks, what we should wear. So Deanna found this really great graphic, and I think it outlines it really well because it's a gradient protection when it comes to face masks. So obviously, not wearing a face mask, you're really getting no protection. Or somebody lifts their shirt up to cover their face. Now, moving up from that, you have cloth masks, especially ones that are designed more for, obviously this purpose, especially layering it is going to increase that level of protection. Then you move forward to surgical masks, and that'll provide some additional protection because it's 3 layers. And each layer kind of provides a different kind of, unique need. One's reducing moisture retention, one's actually doing the full filtration, things of that nature. And then obviously you get to the best protection you can, which is going to be like your full-fledged respirators and high filtration respirators like the N95. So N95s are going to be much better than, say some of the KN95s or the KF94s you might have been hearing about. The KN95s and KF94s, like the ones I showed here with this image, even though this one was not adequate, they're somewhere in between surgical masks and the N95s. N95s obviously be much better in terms of that protection, and also much more certified because it goes through a very stringent manufacturing process to ensure that it meets those standards. It also has the electrostatic capability to help filter viruses as they pass through the air. So that also really helps. It's not just about having the proper spacing in terms of the fibers to filter. It's also that electrostatic charge that helps pull the virus into the mask and not pass through it. So just emphasizing that point. So then also really important, the COVID testing site has changed in a couple ways in terms of location as well as the schedule. So now it's open 7 days a week, Monday to Friday, 2 to 7 p.m., Saturday and Sunday, 9 a.m. to 1 p.m., but it's also at Shady Beach. So just emphasizing that point for the community. So if anybody wants to get tested, it's really important the community still get tested, even with the availability of at-home tests. So it's obviously the PCR test is much better verification in terms of somebody's actually infected with COVID-19 and thus, resulting in the proper isolation and consequent quarantine of contacts. Again, all this information is reported out weekly in the Mayor's Weekly Report. It comes out every Friday around lunchtime. And you can check it out on the city webpage or the city socials, which are Twitter and Facebook. So those are kind of my updates. So I'll open the floor to any questions. Thanks.
Okay, questions for our epidemiologist, Brian Weeks? Yes, Councilmember Burnett.
Yes, thank you, Chairperson Johnson. Brian, the one question I had on the slide where you showed the state rankings, you showed Connecticut and New Jersey, but I didn't see New York on the list. Where does, because it's so close to Connecticut, I'm curious as to what is New York's ranking right now?
So excellent question. So I'm actually pulling up the infographic that I processed on my end. So New York is currently at 26. In comparison to Connecticut's 41. So Connecticut's much higher up in the list. They're experiencing a case rate for that 7 days of 229.51 versus Connecticut's 183.57. New York, naturally, as you can see with the influenza-like activity, as well as COVID in general, has gotten hit hard. Omicron, given its infectivity, takes full advantage of high population density and interaction. And given that there's a lot of public transport, a lot of people squished into one space, and a lot of access to ride sharing and other things, and and other activities that people do there for work or social reasons, it creates a lot of opportunity for transmission. And that's why New York's been hit so hard, especially relative to those cities. And then New Jersey, same situation in terms of population density. That's why. So, I think you might have also heard the analogy when New York sneezes, Connecticut catches a cold. It's very much true. And that's why also Fairfield County gets hit hard once New York starts to present with activity relative to COVID or any infectious disease that has an infectivity like COVID. It's inevitably going to make its way and kind of creep through the I-95 corridor and make its way up to I-91 and jump to Hartford and kind of jump around and kind of do what it's been doing in terms of musical chairs, so to speak, and where it's presenting. But that's kind of the current situation. But yeah, it's very important to consider the tri-state area as well as just to also add to that, Rhode Island's number one at 437.42, so astronomically high compared to everybody else. But is just only a week or so ago in terms of this data, we were up there just with very close to Rhode Island, Massachusetts, New York, New Jersey, and you can see, like I mentioned, with that pincer movement, we were surrounded in terms of activity. Northeast was getting hit hard. We're still getting hit hard, but Connecticut's faring better now compared to where it was even just a week ago.
Oh, and I'd just like to mention for the record, I think I got it at 7:32 that Councilmember Heidi Alterman joined us. For the record there.
Yeah, hi. Sorry, guys. I was
Hi.
on another meeting.
No worries. Was I right at 7:32 or am I?
Yes.
Oh, perfect. Thank you so much. I appreciate it. All right, any other questions? I do have a question, but I want to yield the floor to others. Should you have questions for, yes, yes, Councilmember Smith.
Yeah, this is actually on behalf of some constituents who asked me this question. I actually did get the answer to it, but just in terms of maybe quelling some confusion or misinformation. The question that was asked to me is, do the numbers, the case numbers, reflect per person who's tested positive or per case? And that was, asked by a person who had gotten 5 COVID tests over the course of, a couple of weeks. And all of a sudden they wondered, oh, does each test count as one, or do I only count as one person?
So I love this question because it really kind of emphasizes, from maybe an epi-nerd standpoint, something really important about the data. So, when I was sharing those case rates versus percent positivity, and percent positivity, you might have been seeing in the news a lot. The state tends to focus on it. The news and the media tends to focus on it. The problem with percent positivity is kind of alluding to your point. It's looking at the number of positive tests, and then it's dividing by a denominator of tests conducted. So now, naturally, if you have a shortage of testing and a lot of people are infected, you're going to have an inflated percent positivity. So it's vulnerable to a lot of potential manipulation. Also, if certain jurisdictions have a lot of testing and screening going on, naturally, that's going to bring that percent positivity down when it might not be the true situation. So that's why we defer to the case rates, and that's why I usually bring them up. It's a much more accurate measure because it's looking at the number of cases that meet the case definition that's set up by the CDC and the state health department. So it's a much more verified and more reflective metric in terms of evaluating current activity relative to COVID-19. And it's a better way to kind of see how we stack up or benchmark against other similar jurisdictions, just to see if there's some anomaly in terms of our activity being higher or lower in comparison, and what else could be contributing to that. So going to your point, yeah, case rate is the better metric to use for that. And it's more reflective of that case definition of somebody actually getting infected with COVID-19, as opposed and having either asymptomatic or symptomatic presentation versus, the percent positivity, which has, some other kind of variables that play into that. So I think Deanna wanted to add something too.
Yeah, I just want to add. So just to add to what Brian's saying. So when you look at the case rate, it's looking at an individual person that is tested positive, and if they test positive again, it's not getting counted again. They've already been counted. So it's the number of, it's the people. It's not versus what Brian is saying with the tests is the actual tests.
Thank you. So it's the case rate that you really want to look at.
Exactly. And it gives you an opportunity to compare, how cities stack up, counties stack up, as well as the states, because it's case rates in general are a way to make those comparisons. Otherwise, if you have a standalone metric like the number of cases, it's not adequate, because if you have a high density area with a high population versus a small area, naturally you're going to see more cases present in a high density area. Case rates balance that out.
Thank you.
I think I can jump in with a question too, and I appreciate the mask guidance, because I know from, I think she might still be on our January 4 phone meeting, Ms. Loricelli, you did mention making sure that we talk about this a bit more. And so I guess my question has to do with, we're hearing a lot about fatigue, about COVID, obviously, because Omicron hit at this very inopportune time of family gatherings and things like that. So I think you answered my question, Brian. I mean, it seems like, I'm asking a scientist this, but it seems like that's the reason we're seeing a spike in particular too, because there was so much congregate kind of activity in a very concentrated short period of time. Is that fair to say?
Yeah, so here's the perfect storm that I was kind of alluding to. And there's still many other variables that play into it. We had the holidays, some of the most major holidays of the year. You have, Christmas, you even have Thanksgiving a month before, which kind of helps things kind of, keep escalating each time, as well as the New Year too. On top of that, a lot of activities, people kind of COVID fatigue. You have the cold weather, so people can't social distance. Omicron's infectivity being almost 10 times more infectious than, the original strain that we were dealing with COVID back in the very early stages of the pandemic. It also, in terms of Omicron, the preliminary studies were indicating that it develops more in the upper respiratory tract very quickly too. So that means it's very easy just for somebody when they're coughing, they're having a sore throat, whatever it is, or even speaking too. They could transmit it to others. And so it's much more vulnerable towards airborne transmission, which are those most finer droplets that could travel further and stay in the air longer, which increases that infectivity. And that's why N95 masks are much more appropriate for that. When we're dealing with the stereotypical kind of flu is much easier to mitigate. It's not as infectious. It's usually larger droplets, so it can be filtered out better, even with a surgical mask. And so that's where, that's the differentiation and why the CDC has gone that extra step of clarifying that, KN95s and 95s would be more appropriate. You want to increase your level of protection, and they're making everybody aware there's a gradient there. And that's what we're just trying to share with that infographic before. And so that's why N95s would be more appropriate for the airborne transmission tied to Omicron and COVID-19, as opposed to, say, flu or something less infectious, where, maybe a surgical mask could do the trick.
Okay, thank you. And I've heard other communities potentially having, like, people are getting together because there's a assumption that this notion that we should all just get it over with. Can we have some public health perspective on that kind of sentiment? What do you all think about that? What advice can you give folks on that?
So I can start. I mean, in terms of, getting it over with, I mean, naturally, yes, we have to kind of accept the fact that, like flu, we have seasons and, activity related to it that are just going to happen every year. I think that's kind of the one reality with COVID-19. But at the same time, we want to do everything we can to prevent its opportunities to spread. I mean, naturally, if you have a big fire going on, you don't want to just say, hey, forget it, let's just let it burn. And let's run into it. We don't want to do that. So we want to obviously protect those, especially that might be more vulnerable to, having these more infectious episodes that can lead to hospitalizations or death. Death is still occurring related to COVID and Omicron. And also long COVID is still being better understood. Long COVID being, long-term symptoms that maybe people don't get over. Maybe they have, lung damage, which obviously is much more common with Delta, but, other kind of neurological and cardiovascular damage that can still occur, especially with younger individuals too. That multi-inflammatory systematic cardiomyopathy. It's a tongue twister. I think I said it correctly. But long and short of it, that's also still in play too. And so just keeping in mind that hospitalization is still occurring right now, as we saw with those numbers. Deaths are still occurring. We want to mitigate that as much as we can. And so prevention is still key. CDC is still saying on their language, on their websites, that, face masks are a critical part of, beating this pandemic and preventing further transmission, because we naturally don't want to keep adding to something that obviously is making all our lives difficult. So getting it over with is not the correct answer, in my opinion, but I'll defer if anybody else wants to mention anything else.
Just to add to what Brian's saying, we encourage everyone to take the measures to keep themselves healthy and to protect themselves and their loved ones. So.
Yeah, hi, this is Heidi. I just had a quick question. I know that there's been some articles and the CDC released information about children who had COVID-19 having higher rates of diabetes. I was wondering if you guys have any local information or if hospitals are collecting data on that around here that you could share.
To my knowledge, yeah, hospitals will be collecting that information. Whether they're processing that's probably going to come more from a higher education institution that's conducting a study, things of that nature, as well as the CDC and other higher authorities in that regard. At the moment, we don't have clinical data at that level that we could process at the local level. But naturally, if you hear anything, let me know. I am kind of curious. But yeah, it's something that preliminary studies have suggested in terms of long COVID. This is what I was kind of emphasizing before. It can manifest in many different ways because COVID gets everywhere in the body. The receptors it attaches to and then has impacts in the body is everywhere, especially with fat cells. And so where you have fat, you have risk of obviously, risk and other concerns. So, especially that's why neurological system is also vulnerable too, because it has, the fat sheathing on the nerves and things like that. So not to get into all those technical details, it's just there's a lot of opportunity for COVID to have impacts, and especially everybody's body's different, everybody's health situation is different. So everybody's mileage will differ. So some people may seem to think they're healthy. They might have serious outcomes because something else that might be unknown to them that, ultimately, COVID would kind of contribute to and make it worse. There's also studies we can also look at even with flu, because something, flu's been around for a long time. We could better study it. And, there's months after somebody actually got over the flu, they were still at risk of cardiovascular events, such as heart attacks and things of that nature. So applying the same lens with the COVID, because that's still very much evident here as the evidence with the diabetes and other things too. It's very much a real thing, and we want to mitigate that opportunity by not having that transmission occur in the first place.
Yeah, I brought it up specifically. I'm a type 1 diabetic, but I think a lot of things that people don't know is that virus is typically activated by the presence of a virus. I'm sorry, that autoimmune disorder is activated by the presence of a strong virus. And so there's I think a general feeling by people that think kids don't get that sick and they're not that worried about it. And that's why I wanted to bring this up. I don't know how many people watch our meetings or if anything will be reported on, but it is fairly serious. And I do think parents should consider that, but it's also, I'm glad to hear about, encouraging N95 masks or KN95. My children wear those to school and we feel safer because of it.
Yeah, agreed. And I know with the diabetes with type 1, I know rotavirus was implicated, as a potential cause for that. So I know what you mean. There's a lot of different things. Our bodies are very complex, mixture of proteins and a bunch of other things. And so naturally something that shouldn't be there that can render damage on its own, but also irritate the body to the point that it causes autoimmune response that could be, short-term or long-term. And leading to major effects. Yeah, that's very much something, again, we want to mitigate. So yeah, prevention, adults, because, adults are going to bring it to the house and expose their kids, let alone kids not getting exposed. And also the elderly that are also at greater risk because of also a lot of pre-existing conditions or risk of it. So we have to, kind of acknowledge that we just don't want anybody to get COVID. If we could wave a magic wand, naturally that would help resolve a lot of issues. But at the moment, we want to do our best in terms of that education and outreach, and also making sure that, as Deanna was kind of alluding to as well, with the multiple prevention measures, it's not just masks, right? It's also social distancing where appropriate. Don't go to large gatherings where there's high risk of exposure, especially mixed vaccination status and not appropriate protocols in terms of screening and things like that. There's a bunch of things to consider, ventilation, all that. But, we're focusing on the big things that are very easy to control, which is wearing the face mask, the right type of face mask, wearing it correctly, and, not exposing others and doing vaccination right. And just, making sure that you're eligible for the boosters too, getting that. So not only getting fully vaccinated, but getting boosted. It's really just important to emphasize those points, because if somebody were to get infected, at least they would just have, presumably more mild outcome as opposed to if they didn't. So, just those items. It's all about layers. Think of an onion. We want all those layers to make a nice, beautiful onion.
All right, any other questions? All right, I want to thank, I know that, Deanna, you mentioned, our emergency response team, Councilmember Burnett being a part of that. I heard such great things about the test distribution. Just so people, I know if they might have already heard about it, but are we still distributing at-home rapid tests, KN95 masks? Are those available for folks? Where can people go to get some of these free tools to help them in this?
So the city has done 2 public distributions led by emergency management with, many different departments supporting that effort, including our emergency response team. So they've done 2 public distributions, and there's also been, we're working with our partners to help us with also reach different populations like seniors. And so many of our partners are still continuing to distribute to reach some people. And I'm not sure if Lamont wants to add anything to that. So for helping with both the test kits and the masks. But right now we're pointing people to the federal government too, because they've just launched their website to order additional tests in the mail. So it's also so you can request up to 4 for your household too. So that's another resource right now from the federal government in terms of accessing test kits.
Fabulous. Thank you for letting us know that. Lamont, if you have something to add or not, I can just pass, I think, the floor over to you unless there are any other remaining questions for our health department team. I know, seeing none. All right, well, thank you both so much for this. I know a lot has happened since we last met with the Omicron wave, so I felt it was, I think for all of us, it's really important to see the work you're doing and to understand this on a more nuanced level. So thank you so much. All right, thank you all. Appreciate it. All right, Lamont, I'll hand the floor over to you. Thank you.
Sure, thank you. And thank you both, Deanna and Brian. I too echo those same sentiments around the work that the health department is still called upon. And I hope people see public health was a quiet entity pre-COVID, and now people really see why we need public health, why we need to invest in public health, and why we need to work with public health to ensure that our residents remain safe. So thank you. I too also want to echo Councilwoman through you, the great work that Michelle DeLuca and the many departments distributing over 20,000 home kits. I was involved in some of the planning. I know there was a lot of activity going on, but we made it, we did it. And I hope those that really needed it had an opportunity to get it. And now with the federal government releasing the mail-in, we'll encourage residents to utilize that as a tool, and then continue to use Veterans Park, Calf Pasture, and the many testing sites that are available. We have many tools, and we're constantly promoting, advocating for additional resources. So the home health kits was just another tool to support what's happening in our community. So at the top of the hour for me, I want to share some updates and then get to a very important conversation and discussion. And I hope I can share, because I have a slide deck too. We are a slide deck people. So to the Common Council Community Services Committee, I want to at least give some updates with you all. First and foremost, that we just closed the portal for the Human Services Director position. As you all know, Maria Escalera resigned. I don't even know when now. It's all getting kind of fuzzy. I am now currently in the process of reviewing the applicants. And as you can imagine, I'm going to personally try to move as quickly and expeditiously as possible to start the interviewing process and get a human service director. For a time such as this, we are definitely in need. I think it's also important to share with you all that we also have an open position with the Family Navigation Program that I'm actually presently now interviewing, and which is excited about that. And just yesterday, we made an offer for employment to a part-time community resource specialist, where as of last night, we are waiting for this candidate to accept. And if you recall, when I first presented, I was advocating for a community resource center because from my assessment arriving in Norwalk, I observed that while there are many, many nonprofit services around the city, from a resident perspective, especially, most people don't call for help when they're doing all right. There's usually distress and a lot of things going on. And so creating this service, we are seeing a great return on investment, where residents are calling, basically just asking, what's available in my community, what's available in my city, can you help at least direct me and guide me? While there is the state version of 211, which they will help with services locally, but the Community Resource Center here at the city, we provide, really real time, we can tell you what that capacity is, and also when appropriate, that have that resident come in, because again, people are reaching out when they're in distress, and having a person that's warm and friendly, and I'm really excited that we have bilingual Spanish. I'm hoping to hire a Haitian Creole for the Family Navigator to actually have that resident come in and sit down with them in a private setting to help them figure out where they start and how do they get services. So really excited about that. So let's move on to a topic that Chairwoman and I talked about. I know this conversation will be broadcast, so just, in setting some context, I prepared a slide deck, obviously, for the community services, but I also worked to prepare a slide deck that residents can find informative, and also to individuals and organizations that I've worked with, that I've been talking to try to respond and to answer as many questions that I can around the Equity and Justice for All initiative. Now, semantics and wording is very, very important. I remember under former Chairwoman Barbara Smith, people thought the commission was already established. So I want to reiterate that yet again, because I still get inquiries around the commission. The commission is not established. So I'm referencing this as the Equity and Justice for All initiative. One of the activities from the initiative is to establish an Equity and Justice for All commission that I'll go into detail. So let's hope I have some good luck. This is always the fun part, because everybody's watching you try to navigate the buttons. and you hope you do a good job. So can you all see my slide deck? Great, Andrew, thank you. So, and of course, through you, Chairwoman, I'll entertain any questions afterwards. And also want to welcome our new council members. I'm not sure what you know or how much you have been engaged prior to your appointment, but I also considered you in really trying to level set and and speak to where this started, what happened, and where we are. So I hope you also find it informative. So progress to date. This is a statement that the city put out back in June 2020. The murder of George Floyd in May 2020 brought about local and national protests and has proven to be a defining moment in our country. Here in Norwalk, we are embracing this moment. We're not hiding from it. And we view this as a chance to move forward together to become a stronger community. And I just want to bring us back to what we said, basically, no, not necessarily 2 years ago, but some time ago, maybe a little under 2 years. We're just approaching 2022. And I do believe that our commitment to embrace this moment, our commitment to not hide from it, and to view it as a chance to move forward is still evident, is still real, and is very strong. However, there has definitely been challenges, and I hope to articulate those challenges in a way that people can understand and appreciate the process thus far, but in no way am I to suggest, are we there yet? In no way am I here to suggest we got it right, but what's important, we made a commitment to be transparent, inclusive, and collaborative. So what were those 4 main objectives? Many residents know that Mayor Rowland talked about there was a 1993 Blue Ribbon Commission on Race Relations. That's a long time ago. And he charged my department that let's look at this document. We all know that oftentimes there's strategic plans and documents and often get placed on the shelf. So the commitment was not to repeat history, but to do our very best to look at these issues. And we started with this report. While the report had a lot of details, the report, in my opinion, was not executed to then look at how do we identify strategies to improve race relations. Those that have read it, and many have, unfortunately, if you can erase 1993 and at the time put 2020 and change the context, that many of those same issues persisted. The context may have been different, but housing and things that this commission report articulated were still pretty relevant. And so that's where we started, that a part of this launching of the Equity and Justice for All initiative was to look and review and update where the city fared as it related to the 1993 Blue Ribbon Commission. From that task, we also promoted or implemented or executed rather to a community engagement stakeholder analysis. In other words, how do you do that? Well, you got to talk to people and engage people. And from there, we also decided to suggest or propose, because it will still have to go through Common Council, a development and structure for an Equity and Justice for All Commission. That's the commission, not the initiative. And then phase 2, objective 3 was to engage city leadership, myself and my colleagues and my peers in departments in building equity into practices, policies, and citywide initiatives. In other words, I like to explain it as that putting the mirror and looking at ourselves to say, are we part of the problem? Are we perpetuating bad practices as it relates to equity and justice? And then objective number 4 is to facilitate a community engagement strategy focused on police interaction. We know the tragic death of George Floyd highlighted, but in no way does it suggest that we don't love and appreciate our police officers. I have relatives who are police officers and military police officers, but the community's perception is that they feel unsafe, they feel not heard. So we said, well, let's create a process to talk about those discussions and look at ways to improve. Because I come from a perspective that there's always room for improvement. So what has been the progress? Well, you cannot talk about this work without the context of the pandemic. The pandemic has changed how we engage and interact. I'm talking to you through a box. I think 60% of my day is talking through a box. Some days I like it, some days I don't. And we work to produce several in-person and remote community engagement activities. They were held, and approximately through the consulting firm to what they reported to us, approximately 100 people, maybe a little bit more, have been engaged. We also asked the consultant team to focus specifically on phase 1 objectives and gather information from the community outreach that they did thus far and prepare to us initial findings and recommendations of that process. And I'll talk about that a little bit more. Also during the process, while efforts were made to promote participation, we were not seeing, meaning the city, the turnout that we would have liked to really say this was a community engagement process across all sectors. As this committee, and I presented to this committee since I've been here now, has heard, pre-COVID, community engagement is hard. How to get people to the table pre-pandemic, pre-COVID. And this challenge was before us. And I make a note that this work is no different from any other community engagement process. How do you get people to the table? People were engaged, but when you really look at the best practices of community engagement, you most certainly want those that will be willing to come to the table. But how do we engage those who, what we call our non-traditional community members who say, what do you want my input? You're not going to care what I do. We really worked to engage residents of that. We really worked to engage a cross-sector of diverse, not just from race, ethnicity, but from economics, from neighborhoods and so forth. But it was most challenged, and again, challenged even more exacerbated because of COVID. So over the past 4 months, varying views in the approach persisted with the consulting firm. We had some disagreements. Let me put it straight and forward and be very clear. It was challenged. We felt that some decisions that they made weren't in the best interest of our community. I also want to point out to remind you that this was a partnership with the Fairfield County's Community Foundation. Those that were on the previous council are aware that not only did they have a representative to help us with the strategy and thought leadership, the Fairfield County Community Foundation provided an investment of $50,000 because they believed in this process. I'm just moving my little face because I can't see the other blue one. So our commitment is to stay the course. And so you're going to hear me talk about that we are prepared to release the report that was submitted to us from the firm. And you notice I emphasize as is. I would suggest that this is not a complete report. And I'll talk about that a little bit more. So let's talk about it. So this is the timeline that I think it puts in perspective. As I pointed out earlier in the progress to date, May 20th was the tragic death of George Floyd. And we all saw communities figure out what did this mean for us. In Norwalk, we looked at ourselves. You can see in June, the city announced the Equity and Justice Initiative. This was our way of responding around the tragic death of George Floyd. July, August 2020, we launched an initial RFP. It was discussed the city should do it. I firmly disagree with that. We cannot self-evaluate ourselves. In fact, best practices suggest if you're really going to do this work, you should hire an independent consulting firm or an independent entity to really help look at the work from an independent lens, so we also can be held accountable. Again, for those that are new, unfortunately, we did not get what we felt were quality RFPs. So we made a decision to go out to bid yet again. And you can see that process happen in November, December 2020. Well, Lamont, why so long? Well, there's regulations that the city has to comply with when you go out to bid over a certain amount of money. We went out to bid for $150,000. We couldn't just hand select. We had to go out to bid. So there was a whole process that we had to comply with to make sure that we were doing it right. So we went out for a second bid, a second launch. And what we also did, we learned and tweaked the RFP, made some changes, and we actually extended it, because here's my perspective, that during that height of that summer, a lot of organizations was engaging equity consultants. And so it was really difficult. And our budget was $150, and equity consultants had an opportunity to find the best bid and best price for them as businesses. And so we selected a firm, and in April, a contract was executed. And I also put, this is the work plan that they designed in terms of their quarters. And then in May, the Fairfield County, as I pointed out, provided $50,000 toward this initiative, and we're really excited. So April, May, June, July of 2021. As I pointed out, there were some various differences in the approach, the strategies, and how the firm showed up in our community. And we've had many, many conversations over that period. But we made a very, very difficult decision to separate. And that happened in August 2021. So we produced a closeout letter to render to separate based on our concerns around working with this firm. In that closeout letter, we asked them, based on what they have done in our city, to document what they did, to create an initial report based on their findings, based on their conversations with those that have been engaged, again, about maybe a little bit over 100. And we asked for this to be done, we gave them 45 days, and this was negotiated back and forth. And so the due date was September, around the deliverables that we asked to submit. It'll also be important to say that, as I pointed out, this was a $150,000 program, and based on the closeout, we have paid $75,000, and we have $75,000 left, which is a combination of city funding and the Fairfield County's Community Foundation. It's also important that this difficult decision was not made in isolation. Fairfield County Community Foundation has been engaged since May, part of the leadership team, as I would say, meaning the internal Norwalk team, as a thought partner, as a strategic thinker, providing technical assistance, and really being front and center with the strategy, supporting the firm, and just supporting the city's endeavor to what I would say to be courageous and step out and say, we're going to do something. I think it's also important to say, to my knowledge at this point, given what happened, there's no other city in our state that has taken such a bold statement and bold approach in this manner. And so we come to October, November 2021, because often this is a long process, and it is. However, I'm going to always remind everyone, COVID, and we just talked about the Omicron variant, and what I did not put in. Remember, we had the Delta variant, and we're all hoping we don't have another Greek alphabet. But depending on what you read, that may be coming. But the firm also asked us for an extension on their deliverables, and we certainly granted them. And so in the months of October and November of 2021, we received the deliverables, including an unfinished report, and I put that in quotes because we believe the report they submitted is unfinished, but we also require them to put something in writing so we have documentation and a record of what they've done, how they've done it, who they spoke to, what was their strategy, and what was their approach. So that's the document that I'll be referencing moving forward. And as mentioned, we also have asked them as part of the original the 4 objectives, they did start work on this concept idea of creating a structure of the Norwalk Equity Justice for All Commission. I should know that by heart. And they submitted from the phase 1 deliverables. So we have that concept proposal. And it's a proposal. What we asked them to do was help us understand, because we don't have, one of my models is we don't have to reinvent the wheel, but do what we call in college a literature review and let us know who's doing what. And then we can look at that research and see what makes for our city. So they have drafted a concept proposal on the structure of the commission, which was part of phase 1. And that, again, October, November 2021, excuse me. So to summarize the deliverables based on our separation, we have the unfinished report, which is entitled the Conditions Analysis Report, and it does include a 4-page table based on their interaction in our community with those that have been engaged, a table of recommendations. It also, as I pointed out, the five deliverables that we requested to separate is the concept draft to form the Equity and Justice for All Commission. They've also provided at our request a list of who they spoke to and who they engaged over that 5-month engagement period. They also proposed what is called the Community Action Partners Group. They were the consultants, so they were hired to give us some input of how do you do this and what should it look like, and kind of help us think about systems and practices and what would be the configuration of just doing this work moving forward. So they also provided a Community Action Partners Group proposal. This is not something we asked for, but based on their recommendations, they suggested that the city should look at this as well. And then those that have been engaged, they were hired to do a campaign. So we now have access. I now have in our possession, on behalf of the city, all the social media assets of Norwalk Speaks. So that's what was delivered to us October, November. So December 21, which is last month, phase 1, we have in our possession those documents, and myself and team have reviewed the submitted documents. Because of the separation, phase 2 has not been started. And so here we are today, January 2022, and what we are planning to do is to release the condition analysis report as is. And I'm recommending to get community feedback in structure to gain public input based on this document. I guess I'll reiterate, when we first initiated, we said we will be transparent, inclusive, and collaborative. The city should not make the decision in isolation, which is why we were very excited to have Fairfield County Community Foundation as part of a strategic partner. And we've also worked with Norwalk Acts and others around this process. Then, again, these are proposed to have a facilitator lead these structured feedback and response forms or community conversation, looking at having, an expertise. So it's just not an open conversation, but focused and geared to the document so we can relook at next steps. And again, as many such as myself, how do we continue to move this conversation with action and results? But again, we're not there yet. And then March 22, proposed recommendations based on those conversations. I also wanted to point out, as you see there is an asterisk, that if the current firm was still with us, March 2022 also would have been the end of their contract, and we would have to make a decision whether we want to continue. So I want to go back and just uplift and elevate the community engagement piece. This is from an article, Community Engagement During COVID-19 Pandemic and Beyond, and you're more than welcome to look at it. But I love this quote, and I think it's important to put front and center with the context of COVID, that community engagement must begin by building a personal relationships among community members. As I pointed out, engaging in community is difficult. You all know, and I mentioned this to this group or in other settings, the community already has it, not everyone, but I can speak specifically, oftentimes vulnerable and marginalized communities often have a distrust in the community. I think we're seeing that right before our eyes with the vaccination strategy. Whether you're pro or for it, what we do know is that there's a large population in our country, in our community, that just distrusts the government. So I would like to connect the dots and say this process is no different than having a government entity say, we care about you, we want to make a difference, which is why we have made a concerted effort to hire an independent consultant to really help us through this process. I also want to point out that do not want to minimize those that during COVID either came to a meeting, whether at our library, at one of the churches, or one of the schools. I want to personally thank you for coming out and being part of the process. I also want to make mention that I'm also very aware that people had different and varying experiences of the process, and we most certainly acknowledge it, and we most certainly heard it, which I believe as a result, we had to make the tough decision whether to separate with the organization because our community spoke loud and clear and we responded. So where am I? Where are we? So I am proposing these next steps to release the firm's condition analysis report as is, which represents the largest of all the deliverables, engage in a productive process with an experienced, well-skilled facilitator, and that needs to be scoped out and scaled out. That's why we bring experts. Emphasize really on the outreach effort, strategy to increase participation, whether in a hybrid remote engagement effort. This is going to be the tough part, to really, to the extent that we can, get community participation. But also, I think we have to look at ourselves and be very clear about what equity challenges, because it's called the Equity and Justice for All initiative, but be clear about what equity challenges are already present and or exacerbated by the pandemic, and consider what groups may or may not be a part of the conversation right now for whatever reason, and how do we mitigate any conclusion? That's hard. I don't have the answer, and we're hoping the community helps and be a part of these discussions. So that is where we are. That's what we're proposing to continue this conversation. And through you, Madam Chair, I'll turn it back to you, and I'll respond to any clarifying questions that the committee may have.
Thank you very much, Mr. Daniels. Before I ask for questions, I'll say that I felt that was a very, the transparency I really appreciate around this process, and I'm really grateful that we can now have conversations in our committee about next steps with you. So thank you for that. I do see Ms. Revolus has her hand up. I'll start with you. Oh,
Can't hear you.
We can't hear you. Oh, sorry about that. Okay, we'll catch you on the other side. All right. All right, very good. We're having a night of turning off and on again, but I think it'll work. Yeah. So any other questions next in the queue? And then we can go back to Ms. Revolus when she's back with audio. Yes, Councilmember Burnett.
Yes, thank you, Council Leader Johnson. So Lamont, lot of information to take in a short period of time. But thank you for the presentation. I guess my question is around when we look at the timeline going forward, what do we envision? You kind of laid down next steps, but what does that look like in terms of timeline? Here we are, January 2022. When will we, for lack of a better term, start seeing some traction as it relates to this initiative?
Well, Councilman Burnett, I think that's a great question. And I think that for me to own the timeline, I think that would be a fair assessment. And I think we all need to work to own the progress and process. As the timeline pointed out, there were starts and stops, engaging the community, and to the firm's process. If people weren't gathering, then there's another month that has happened, and we did push the timeline out further because this work requires people participation. There's no other way around it. So the work happens as good as the participation. Because I think, it's a blessing and a curse in the sense that we can kind of move forward, but then, we may hear, well, the community wasn't involved. So I think it's a challenge in terms of where we are. This process of where we are today, January 2020, is as a result as our outline. This work is difficult and challenged, and we need people to participate. We need to figure out the best way to remove all barriers and concerns of people feeling that this is just going to be another process, because we heard that very clear right at the onset. And so in terms of a timeline, the March 22 was the firm's potential time to propose a commission draft. Well, now we're set back, and we'll be working with, which I'm proposing to work with some other entity to help us create that work plan. For example, I didn't create the work plan. The C didn't work the work plan. We said, these are our goals and help us get there. And what do you think is a doable time? We reacted to what they said and said, can you cut this short or you cut this share? But to say, what is the timeline? I think the process is the process.
Would you like a follow-up, Mr. Burnett, or I can go to the queue? Okay, very good. I see.
No follow.
No.
Can you hear me?
Yes,
Yeah.
ma'am, we can. That's right. Sorry, I talked over you there, Greg. We're good. Okay, to move on, Ms. Revolus and then Ms. Ayers. Thank you both. And then Ms. Alterman.
I just wanted to say two things, pro or against the government. You said pro or for, and being someone against, pro or against. Then secondly, reinventing the wheel, do it. It's because it's innovation that you lack when you don't want to reinvent the wheel. That being said, there's a lot of things within our community that we don't move in the way that we're trying to be equitable. So therefore your community doesn't believe you're equitable, right? For example, in my area, I'll use it again. I have 4 vape different shops, but the same community who's been arrested for that same exact thing isn't in that community or in that equitable space at all to financially get it. The realities are, if you do more for the community, especially on an economic base, they would then trust you more, right? Your employee or your experts live here. We don't have to hire anybody. They live here. They go through this on a daily basis. They grow in this. It's happening to their schools. It's happening to the kids right in our schools. I can tell you crazy stuff going on in Norwalk High right now to children they don't even talk to about college that look like me. Okay. So again, when we're talking about equity, I feel like we're just using trigger words to sound good because an event that happened, but that event has been repetitive. I grew up with what happened in California, right? Watching a man get shot by police, whatever. I grew up with a community of people getting arrested for what was put into their community, right? So then generation of men left our families because of what was happening to us. So to ignore exactly what we're coming from, what we're doing, and in particularly when you say equitably, it starts with finances. It starts with how you're actually engaging and what you're doing for the community that actually shows results that then gets them to the table. A lot of this to me just sounds like rigmarole and talk and jargon, right? But when we really come out and say, you know what, I'm going to help you get a business. I'm going to help you get your kid to college. I'm going to help you have a voice for real. I think that's when you'll see the community show up more. But it's too much of us not trusting you. And I'm saying that as a person, not even a councilwoman, but as a person who doesn't trust y'all. Okay. So that being said, when I'm going to dealing with my child, dealing with other people's children, dealing with their families, even the proper, in not only feeding people, but feeding them properly, nutritional wise, that's where you get people involved. But when you don't come to them and you keep expecting them to come to you like you're doing something different, they're not. How many of us are in affordable housing situation, but none of us are being talked about home ownership and land ownership, right? There's no equitable changes that are happening to a community that's been perpetually targeted, not only in Norwalk for years, keeping going centuries, but in America. right? I could even say that being Haitian American, who's even ignored about what's going on to the borders of my people, but you'll take in a bunch of others. That's what we're talking about when we're talking about true equity. Reinvent the wheel, become innovative, come to them in a structure and place where you're actually showing them real change, financial structures to their life of change, and then they'll show up more. Okay, but we are in a space and place where we don't trust the conversation. And a lot of the conversation is just going to pay people and not pay us. I can tell you right now in the article that I read, I'm really annoyed that two of our strongest structures in control is where our money is going to. And that's the superintendent and the police department. That's a problem. We have people right in this community who can take that from that and either, again, become homeowners or become business owners and real change, so then that they show up, because if they see it in their pockets, they'll come to you and converse. And that's one of the biggest problems we already know in equity. Financially, the bridge is too far and too open, right? That's one of the first things. How do we look at what we know? We don't have to reassess. We don't have to do these meetings. I went to those meetings. I can't tell you how many times I spoke about the same exact thing. We're still here, right? It's again, being intentional with equity. It's being intentional about these initiatives. It's not just to say we did it. It's also okay to be different. It's also okay to be new. It's also okay to be innovative, and it's also okay to do everything differently than the surrounding is doing, to show that we can be the stepping stone, the first, to show how, again, like I said, how we care about our people differently. Once we start doing that, break the cycle, change the wheel you're using, our people might show up better, especially in our youth, because they've seen something change in them. You know what I mean? And particularly, how are we giving an equitable situation to our new generation going into college or new adults here? We don't even facilitate a community that fosters family growth here. So how are you talking about we're equitable in anything that we're doing right now? Reinvent the wheel. Understand a lot of us are against, right? And you have to do a lot more to get us to the table. And that's what I just want to say.
Thank you, Councilwoman Revelous. Councilwoman Ayers.
Okay, thank you for the presentation. And thank you, Madam Chair, for the opportunity to address my question. I think I want to ask, that I'm trying to frame it in the correct manner. When you acknowledge and when you identify the next steps and the fact that you feel that the timeline has been extended, but the rationale for the extension of the timeline is one that was unpreventable, as i.e. a pandemic. You identified a facilitator. You identified that this person needs to be of an independent source, not connected to anybody, to continue this much needed work. I think we all agree that the work is needed and we want to complete the work. What is your process, or how are you guys going to facilitate going to the next stage and not just being in a limbo? And if I understood your presentation correctly, you will be publicizing whatever report you have to everybody for feedback. So how are you going to facilitate that feedback? And then how are you going to facilitate the next steps with the facilitator? Am I clear? It makes sense in my head. I don't know if it makes sense when it came out.
No, thank you. I think so. But it is also my understanding that once the report is released, we're going to release it to Common Council and then to the public, and then for the February meeting, because I don't know, I haven't released it, so I don't know who actually has the report. So I think there's a missing piece that I think once people get the report, and I think this is the issue. Well, maybe that's not the best word, filter, that it's a us council people. And I think for some reason that message has not been articulated, that we all have to own this process. And I've made it clear from the very beginning, If people are really expecting the city of Norwalk to lead and pioneer this by itself, that's just totally absurd. No city can do this without having the community. And when I talk about community, I'm talking about people, institutions, businesses, people from different neighborhoods and all walks of life. So this is an effort that the community, that we're hoping the community will embrace. So I can answer your question by this, that the plan is to release the report, which is my understanding. This committee will then have an opportunity to look at it. And then this committee will give feedback of what your thoughts are. And we have a discussion around what would be those next steps. But it will be this committee with me kind of facilitating and helping. And I have some ideas and suggestions, and we look for your ideas and suggestions and come to some agreement of where we might want to go. I gave you a preview of at least of my thinking is around, once this report is released, what do we do with it? Well, I can imagine that some people want to say, well, I want to give input or have questions. The way to do that based on best practice, you got to have a facilitated process or a structured process. So people are just not talking. How do we synthesize it? And then how do we hear and then say, based on those who are willing to engage in this report that as is, what's the feedback? And is there anything worthwhile that can help us identify what those next steps are?
Okay, thank you. I think that is important to articulate so that people can go reference what is going to be happening. Thank you for the clarity. And then when we're getting questions, at least we can help people along and understand the process in a more concrete manner. So thank you for that. Madam Chair, because I got kicked off, I will wait and hold my other questions, but I had some questions for the health department, but I got kicked off. So
I saw that. Now,
yes.
Now, I assume I see Ms. Demore here and Mr. Weeks, so maybe we can, is that all right if we get them back on for those questions and like after our conversation here, is that all right?
That's fine. I have a questions, but I was ready, but the computer, somebody
I
kicked me
know
off.
it. It's been that kind of night, I swear. It's everybody. So, all right, well, that's, if you're all right, then I'll go to Ms. Alterman now. Thank you so much, Ms. Zaret.
Hi, I hope everybody can hear me okay. Sorry, I also got kicked off, so
Yeah.
I'm now on my phone. I just had a simple maybe recommendation. So Google Forms is, and it doesn't have to be Google, is something that's really simple for somebody to create. I'm wondering if there's a way to put those throughout our high schools, our middle schools, even elementary schools, not just to the students, but also to the teachers, the staff, community members, things like that. One, to ask the question of what do they think is happening in the city with regards to equity, but then ask them, you can do short answer questions and multiple choice. What do you think we could do better? How? Explain. Give people a chance to give their input without having to show up to a meeting. I think you will see a lot more involvement, and like Councilperson Revolus was saying, I do think give people a chance to say their piece. They might be completely against anything the city was already going to do. I think it always helps to have people communicate what they need and not always be told what other people think they need. So that's all I wanted to say. I just found out today about this amazing thing called the Appleby Health Center that's at the high schools. They offer mental health services, and they also do in a few of the middle schools. I would assume if we collaborate with them, they could help with something like that, as you were saying, like an existing organization. That's all. Thank you.
Thank you very much.
Thank you, Councilwoman Alterman. I saw Councilwoman Smith first and then Councilwoman Reynolds.
I just wanted to thank you, Lamont, for the presentation, the honest and transparency. We've talked about this so many times, the frustration in the community, because we want to see action. We want to see this initiative move forward. So I really want to thank you for the presentation, and I think we all very much look forward to seeing that report. And then once we do, we can start to really work with it. And, I want to go back to Ms. Revolus's comments because, Diana, you really, get to the heart of the problem. you know, and that, you know, these structures that have existed in our society for eons, you know, and this is what we're battling against, right? So, you know, you really get to the heart of it. And I think that, you know, moving forward, this is what, you know, when we talk about like, you know, facilitating the work in the next steps, that's, you know, that's what we need to see. We need to see the report, right? We need to see it. We need to read it. We need to bring our community leaders in, you know, for additional feedback and take it from there. And I think, you know, really for all of us, this can't happen fast enough, but, you know, we need to do it right. So, thank you.
Thank you, Councilwoman Smith. Councilwoman Revelous.
Thank you so much for that.
Well, you're sounding a little.
With my
Now we
last
got
thing, from what Councilwoman Altman said, just for like, I'm just gonna speak out for the people that like that's not gonna go on Google, or people like me who just, all these surveys are just white noise and I purposely don't do them, right? Again, I get that there's this situation, but coming to people to ask them that, like, you know who would tell you exactly what's going on? Someone on the street who's waiting to get back into the shelter. You know who else would tell you what's going on? Someone who's been here for forever and a day, who's picking up cans. They're not going to be at the place and space to go to the Google Forms, but they've been here long enough through the struggle to tell you what they need. Okay. Again, when you reinvent the wheel, some of it is just coming to our community leaders, which is our residents. We are the servants to them. And again, what they said, ask them what they want and need. And I promise you, a lot of it goes straight to financial assistance and development so that they can stand on their own and have generational stability. Once you get that,
Oh, you froze, I think, and that was right.
even in the way we can access the strongest voices, isn't the way we can access them. They're not on Google. They're not on the computer, but they're right in our district 24/7, right? We just need to stop being this scared place and come back to our community and just talk to them. That's literally, and I think you would find out so much that would change the way you look at that wheel. Even if they say that wheel should have spinners on it. But it's what they say they want to see, just like you said. I think, again, we just have to come out of our structure and our bubble and get to the community, especially the ones who are the most vulnerable, because they will change it in the biggest way possible. Right? That's all I want to say. And then I want Ms. Councilwoman to be able to say her questions to the medical part. So I don't. So I'll let it go, Nicole. But that's all I want to say. Just again, just stop. Don't be afraid to come out your office. Don't be afraid to come off the computer in the box. Talk to people directly. Don't send these representatives, say whatever. Talk to them directly. They should know your face, Lamont. They should know my face, Diana. They should know us. They should be able to call us and say, this is what I want.
Thank you very much, Councilwoman Revelous. I'd be remiss to say, and I apologize, Councilwoman Young, if at any point you'd like to make comment or ask questions anytime during the meeting, please raise your hand if you like, but of course, no pressure. Any other committee members or council members have questions? Yes, Mr. Burnett.
Thank you, Madam Chair. I guess my question at this point is, so what is the message as a council that we should be taking forward as it relates to this initiative at this point? Is the watchword be patient? Is the watchword get involved? You know, what, based upon what was shared with us, what do we communicate going forward at this point? I'm asking because I don't know the answer at this point. So I'm trying to understand, now that we have seen the timeline, we understand the situation, we have a vision in terms of what's going to take place in the next couple of months. But at this point, what is the message to the community, the city of Norwalk, as it relates to this initiative?
I think one of the points that I articulated which was a challenge is the community participation. So I would say get involved. These people, and I respect everything you're saying, Councilwoman Revelos, around meeting people where they are. I'm not going to go into what I do on a regular basis. I don't stand in a box every day. People know who I am in the community. Now, I'm not going out too much right now because of COVID, but I have visited many communities that maybe others may not have gone to make my space known, and residents do call me directly. So, but Councilman Burnett, I get involved, be patient. But again, I think we all gotta just own it that I laid out, this is what happened. This is where we are. We're gonna stay the course. This is not easy work. Draw them to this YouTube presentation. I know it's going to live, and say, hey, we need you at the table. And then to Councilwoman Revelos, we have to be creative in the different ways, to your point, meeting people at the open door shelter or different places in the community to get input, and look at 1,000 ways of how to get people involved in this discussion. But I think we also have to honor and acknowledge that this is an issue in any city. All the different strategic plans that the city has incorporated since, trying to get people at the table. I think that's a challenge. These are systems or challenges that are not brand new. So I don't know, I'm challenged by that, but I would encourage people to get involved.
Thank you, Councilman Burnett. I'll just add a couple things I've been thinking about based on our conversation. The first of which is just, I'm reminding myself, and the timeline was so helpful. Thank you, Lamont, because, this was a mayoral initiative that came our way because we were asked to, make sure the consultant's contract was approved. There are other aspects of the council that would potentially become involved in the coming months. But I think what I'm finding here is that I'm just glad that we're moving now in a direction where it looks like our committee here will be where we have these initial council conversations, if I'm not mistaken, right? So just for a timeline, and this gets back to Ms. Ayers and Mr. Burnett's points a bit too. So what we can expect is that members of this committee in particular, but the council at large, will be getting this report in, is it about a week or two? What should we expect? Okay.
Correct.
Okay. And great, thank you. And so when we get that report, I think our charge, it seems to me, is to read it thoroughly, and then we can obviously have conversations amongst ourselves. But then on the February 16th meeting, that's when we're going to be talking about your proposed next steps in our public conversation here. And I've got that correct.
And feedback from, everyone would have the report. So yeah, I'm going to propose some next steps, but I would hope that everyone has varying expertise here to also say, based on what your constituents are here saying, what are you thinking about next, and how do we create a consolidated kind of next step plan? And I think that dynamic, I would like to change that. I'm proposing this. I think it's a us. I want to change that me to a we. This is not a Lamont Daniels project. This is a we project. And it's the push and pull. We're going to debate and negotiate what the next steps are, but that's healthy. But then walk away with anything that we all do to a plan that we can all kind of live with, just like with any negotiation and compromise. But I think most important, if the people respond, they'll tell us what we should be doing. And that would be my desire.
Okay. Thank you for that very much. Any final comments, questions about this piece?
Report, can that, like Councilwoman Alterman said, in the reports we're getting, can you think of a questionnaire that report can create? Because I myself would walk to people directly and ask them questions and fill it, even because they don't want to fill it out. Like I would go out, there's been stuff had or whatever. How do you feel about this? Like, can that report create a questionnaire that people can take out to communities, put it up in bodegas or corner stores, liquor stores, grocery stores, Walmart's, store, whatever, or be the people to actually come into the community and ask them the questions from the questionnaire that was created from the report?
Is that a question towards me?
Yeah,
I presume, yeah.
definitely.
Um,
Yes, Lamont. And also know that I'm using
with
you as an
all-
example. I'm not saying that you don't do it. I was just using
Oh,
that
no,
example, but that's a question.
And I appreciate that, you know, to be fully candid, that's going to require resources, Councilwoman. Who's going to do that?
If the questionnaire could be just created from it, if that was to, I would do it. So can the questionnaire be created that literally I can talk to the kids that I work with, I can talk to family members that I go to, I can literally be outside on my corner and ask people, because I would do it. I would literally do it.
What you're describing is what I started talking about, but we want to talk about it more on Friday around those next steps. We do have some resources left to then help create what would that scope of work look like to make sure that a wide variety of people, children, adults, different communities, different walks of life, and that can be the scope of work to have and use those resources to make sure we have people or we're committed to making sure it gets widely disseminated with the questionnaire, which I think is a
I feel like the questionnaire should come before what you're saying right now, because then it can help motivate that working, those structures and everything you need because of what they asked. That's why I'm asking that, because I would do that. I would literally go out there and do that. So it can help next steps. That's why I'm asking.
I'll have to think about that some more. You know, I'm not prepared
Okay.
to really think it through
Okay.
because I don't know what it would all require and need.
Okay.
Can I offer some help?
Which is just me. I don't have a team.
Okay.
It's
I
me.
get it, but I would do it. I would literally do it if we had it. I would do it.
Can I
Is
offer
there-
some help if it's at all possible, Madam Chair? It is my understanding, and from the presentation that was presented to us tonight, that the Common Council was the one that empowered the work to happen. They rubber stamped the action to be taken. So the thought or the initial process maybe came from the mayor's office, but it came to the Common Council for the action to be taken into place. I think some things that have been highlighted by my colleague, Ms. Revoluz, as well as my colleague, Ms. Altman, are essential things for us to do. But there is work that needs to be done, I believe, at the committee level by council members to ensure the further work of this to be done. That's my opinion. That's what I offer. It might not be a friendly opinion, and I'm okay with that. I hear Lamont saying he's not opposed to that work to be done, but he doesn't have the resource body to do it. But again, it's about accountability. It was a council, not this presently sitting council, but it was a council that approved this work. And it was a council that gave the initiative for the people, led by us to go out and do the work. Now we get the report. The next step should not be done by the city, my opinion. The next step should be done by this committee because that's where it lies. That's just my opinion. So if you're talking about
Why I'm giving myself,
yeah, if you're talking about putting a questionnaire together, to me, that's committee work, not necessarily Mr. Daniels' work. That's a committee work. That's a committee, 2 or 3 people can get together and correlate that and say, well, this is how we want to proceed. I think that might help us, and it might even make the timeline go a little bit faster, because I know I've heard someone, mention about the timeline. So that is just a suggestion, a friendly suggestion. You do not have to take it though.
Thank you for
That was
that.
to you, Madam Chair.
Oh, all right. Yeah, we're all good. And I appreciate that. Thank you, Ms. And I think that given that this is where we're going to do this work on this committee and the council, that maybe some of us can get together after we read the report in advance of February 16th to talk about some of this, the ideas we're describing now, so that we can come to the meeting on February 16 to have a, so it won't be just a full brainstorm session. We will have had some time maybe beforehand to talk about some options before us and what bandwidth we have to do them. I think that's fabulous. Thank you. Thank you very much. Any other questions or comments about this? I mean, obviously, I assume, we're going to be in close contact about it in the coming months. And I know, Lamont, you're always available to answer those questions, but I want to make sure we take the time now since we're all here. Any final questions before we get back to Ms. Ayers' questions for the health department? Thank you for being so patient on that. All right, I want to thank you again, Lamont, for that presentation.
Thank you very much. Thank you
It was
very much.
very
for
helpful
letting
to
me-
frame the work ahead and where we are right now. And so thank you again. I hate to do this, but are our representatives? Oh, there you. Oh, of course, always there. All right, well, I'm going to throw this over to you, Ms. Ayers. Thank you.
Thank you, Councilwoman Johnson. My questions are very surface questions. They're not hard questions at all. I know that on the city website and really like the city Facebook page, I don't go into a lot of social media. But I know like on the city Facebook page at time to time, they will put different alerts and different things up on there. We have heard a constituent come and express their concern about mask wearing. Is there something that could be put up on the social media platforms of the city? And you probably may have already done it, but with the higher numbers coming or already here, can we put up some more information using those platforms to just get the information back out? That was my first question.
Sure, thank you, Councilwoman Ayers. That's great. So one of those infographics that Brian had displayed, I had found that from the Public Health Communications Collaborative, and thought it was really excellent. And so we shared that on social media, and then the city shared it too, because like when we do it, then they share, like it gets, and that got a lot of traction. A lot of people viewed it and shared it, which was great. But that's something we certainly can share again and keep promoting. I didn't mention this in our updates, but our health ed team is actually working on updating our website, updating information about the testing, about all the new guidance with quarantine and isolation, about masks. So that's in the process. So the website's getting updated. We're working on it, and we're always looking to do, more social media, so we can certainly keep elevating that messaging. So thank you for that question.
Yeah, just as a way of getting, and everybody is not connected to social media. So that is not going to be the end all to be on, as you know, Deanna, but just a way of trying to move the ball forward and addressing some of the needs that have been brought before the committee. My second question is, and this may not be you might have to kick the can down the road. As you and Brian have reported with the increased numbers, it has been brought to my attention that the washing stations that were in all of our schools, because we're promoting healthy hand washing, which I always laugh because I think people should have been washing their hands way before this came around, but whatever. As we are promoting healthy hand washing and a healthier living situation, is there any way that we can get those portables back into the school system, or do I need to go somewhere else with that?
So that would definitely be a question for Norwalk Public Schools, but I can certainly bring that up to the health team and let them know.
I think it's a health issue. That's why I'm bringing it up in this thing. If we're promoting healthy hand washing, the health department should be making sure that at least in our city buildings, there are those portable hand washing things for our constituents. Last question, and I promise I will not be a bother. My last question is really about next steps and how are we looking going forward. Many of us on the council are really large proponents of community gardens. I have this initiative that I'm very passionate about, vertical gardens. It is my position that it's going to take many departments and many people to make this come to fruition. We have begun to try to get some research done and some funding sources that the city can apply for. But I would like if you could at all not only to me, but give it to the whole committee, information in a health perspective around the need for community gardens, healthy living, and vertical gardening. Our concept and our thought is really, we are going to put it in places where the need is greater, where there is not as much food resources, particularly fresh fruit and produce. And so in all that I do, I think it's very important for us to have data to support. We just don't want to haphazardly have initiatives. We don't want to haphazardly just do things. We want to be data driven and make sure that we are really answering the needs of the city. So if I could ask you, Deanna, it doesn't have to be you, it could be somebody else on your staff, to really supply to this committee the information about our healthy eating practices in the city. You might have to dig, but something y'all have done through WIC or something, there should be some data. And if it's not a lot of data, at least we have somewhere to start. So I just wanted to bring that up also to you tonight.
Great, thank you for that as well. So we actually partnered with the university to look at food insecurity. So we have a lot of data about that. We also have a summer gardening program, so we can talk about that. And you know, we also have done a partnership with schools around gardening. So I can certainly, that if the council wants that as, you know, if the chair wants it as an agenda item, then we can certainly come back to another meeting and talk more about that. Be happy to do that, to bring my staff.
Yes, absolutely. Ms. Ayers, I don't want to cut you off if you have follow-up or question. Thank you so much. And thank you, Deanna. Yes, actually, I think it's fair to say the majority, I've been talking with individual committee members about issues and actions they are caring about and wanting to pursue over the next 2 years. And I can tell you that a majority of us, community gardens is probably, you know, with a close second to the equity and justice work. And so I would love to add that as an agenda item. And for all committee members, please don't hesitate to reach out about things you'd like to work on, because I bet it's, you know, we're going to be able to work together. As in the case of this community gardens, it's really going to be a group, I think, of us working on that, which is exciting. Absolutely. So thank you for raising that, Ms. Ayers.
Madam Chair, I just want to put a correction.
Oh, of course.
Yes, the community gardens, but particularly, so look at community gardens, vertical agriculture.
Okay.
Vertical agriculture. I think, this is going to speak to some things my colleagues have said, Norwalk needs to be forward-thinking in a lot that we do. And I am a proponent to push some initiatives and some out-of-the-box thinking. There may be a way that we can do the community. Well, there is a way. I'm going to say it that way. There's a way that we can do community gardening in vertical agriculture, but I don't want us to take one over the other. I think we could do them both.
Oh, Ms. Revolus, we can't hear you. Oh no, we can't hear you. Unfortunately, your audio's gone again. Oh, shoot. All right. I'm sorry. All right. Well, either if you want to, if we can follow up offline maybe about that or yeah. Okay. I will say one other thing I've heard from you all that seems to be a great theme is our fantastic libraries and the things that we can further do to support them. And so I just want to take this moment. I know, Lamont, we're already at 2 hours, so I will just be very brief, but if there's any update from the fact we've gone fine-free, I think that's been a real impactful thing that's happened in our community over the past, what has it been, 2 weeks? Or I don't know when Ms. Sherrill did that, but well, the library, I should say, but under her leadership. So
Can you hear me on the
oh, we can hear you now. Yes, yes, Mr.
Try to be on my phone. Why couldn't those be the same? Why couldn't a vertical agriculture and a community garden be the same? Why can't it be a vertical community garden?
It could essentially be the same. The research that I have done in other urban settings, what they have done with their virtual garden, which are sometimes their community gardens, they have also pushed businesses through that.
Yes.
Farm to table. restaurants, they have coffee shops from this. So there's business, that's why I said in the beginning, this will be connecting several different committees. But we got to start with the data and the need. We got to make sure that there's a need. So we're answering the need.
Yeah.
But they could be the same. You can do them both. It could be a community virtual garden. I just think right now we need to start a conversation and look at options.
And I completely agree with you. And Councilperson Johnson, like I said, a community garden goes right into industry for us too. So that's why I said, and even down to Heidi, Councilwoman Heidi Altman with the even thinking about like those fridges that we were talking about as well. Those community pantries type things. So I just wanted to see where that head was at and being both. But again, I 100% agree because it can go straight into industry and which could also hit equity for our community.
Yeah, an important aspect of vertical gardening is it can happen indoors.
Yeah, right, exactly.
Yeah,
so like there's a lot, right?
to
That's why I said why it
business-
couldn't be the same.
businesses. Yeah.
Yeah, exactly. And I'm 100% because guys, how much I push nutrition and people don't really understand that nutrition comes about the minerals, how you're growing, the vitamins, it's herbs. Like it's so much more that helps our whole community become holistically cured and correct. Right. So I just wanted to see like if that frame of mind could see because of the spacing and placings, and particularly for South Norwalk, it is hard to find where we would have that community garden. So why couldn't that be a vertical indoor community garden that can foster those different things? And especially because we don't have proper grocery stores in this area as well, right? So I just wanted to pick your brain on that, but I'm 100% with it. I just wanted to see why it couldn't be both, right? But I get it. Thank you so much.
Thank you all. And thank you, Deanna, for that data on this, and we'll add it to the agenda at some point. I'll touch back with you and Mr. Daniels about that and talk with you all in the Community Services Committee so we can push this further with our idea about it. And Councilwoman Smith, was your hand raised about the indoor aspect, or was there something additional?
Yeah, no, I just wanted to add that because it's such an important aspect of vertical gardening and, in an urban setting.
Absolutely.
It's really important.
Excellent. Thank you all so much. I know we're at 2 hours, so I'll be very mindful. I just want to, I just join together in a shout out to our library and that fine free. I don't know if you have any comment briefly on that, Lamond. I don't want to put you on the spot, but
No, I just think that, Sherelle's leadership, she's been thinking about this for some time. And so this is, and one thing I can work on, two things. We can definitely bring her in if you all want to hear more. But I think Councilwoman Revelos mentioned it. I was kind of multitasking, but this really does address equity because she has the data to see who was really impacted. And so I think we could do a better job of how we tell what the city is doing, but oftentimes we don't call it equity, but it actually is. And this is most certainly a response to making the library equitable. So shout out to Sherelle, and if through you, Madam Chair, they do a fabulous job. So we can highlight many other of the community service programs or services, as you see fit.
fabulous. If anybody would like that sooner than later, we can invite Ms. Sherelle Harris here. Just let me know on email, but certainly let's invite her at some point in the next, at least like several, if not earlier, a few months maybe. Yes, Ms. Ayers.
I'm sorry, and I'm not trying to belabor time, but Mr. Daniels, because your department is so large and you have so many departments under your department, could you possibly arrange each meeting for us to be introduced to different aspects of your department, if that's at all possible?
Oh, you're on mute.
You're on mute.
I know, I hate when I do that. That is a fantastic idea, and I do plan to introduce you to everyone over time. So most certainly, we'll work with the Madam Chair to, cause we did that last time. So we'll work to do that again. I forget this is a new, so just remind me.
That's right. Yeah, and if you think, Mr. Daniels, or any committee members too, if there's an urgency to one aspect of the department, sooner rather than later, we can.
Certainly,
Order, absolutely. Just give me some, just let us know and we can do that. Absolutely.
most certainly.
All right. Any final questions, comments? Or do we entertain a motion?
I was just gonna give you a motion to adjourn.
All right. Is that what you're also seconding, Ms. Ayers? Is that right? Or is that, all right, good. I still want to take that for a question. Thank you all, Ms. Rivers. This is.
Thank you, everyone.
Motion to adjourn. And so all in favor is there. It's unanimous. And thank you all. Thank you, Mr. Daniels. Thanks, Mr. Moore.
Thank you. Thank you, Deanna. Thank
Committee
you, Brian.
members.
Good night.
And thank you, Brian. Mr.
Night.
Weeks, have a good
Good
night.
night, everyone.
Thanks, everybody. Have a good one.
2 ways.